My guest today is one of India's topmost gastroenterologist, Dr. Amit Medev. Sir, good afternoon and welcome to the show.
Good afternoon.
And this I want to make it a very freewheeling conversation. This you are an expert, you are one of India's topmost doctor, but these days we see a lot of people giving lot of you can say the gyan, the social media gyan that do this, eat this, don't eat that, and how to keep your gut healthy and this and that. I want to, sir, ask you, 7 out of 10 Indians, they have gut issues. We all have. You see your family around, yourself, people, they're struggling with gut issues. Why do you think is gut such a big issue in India? Or is it a worldwide phenomenon?
Well, I think it's a worldwide phenomenon. It's not just for India.
Okay.
In fact, out of, say, all the issues, problems which we have with the human body, the commonest issue with any human being faces is stomach-related issues.
Stomach related.
One of the reasons is the digestive system also is one of the biggest and one of the most complex organ systems of the body. You know, we have got various organ systems like respiratory, genitourinary,
Correct.
or cardiovascular, neurology, musculoskeletal.
Correct.
But this organ system, digestive system, is comprising of 15 organs. It's not just one organ like the brain or one organ like the heart.
Okay.
So there are 15 organs which are all performing various functions,
Okay.
and all the functions have to be, each organ has to play their role properly for ultimately digestion to take place. It's like almost like musicians of an orchestra,
Okay.
where one musician doesn't play the instrument properly, what comes out, the end product is not proper music, it becomes just sound. And changing lifestyles, changing eating patterns, mental stress, all this has got direct interplay and relationship to the gut.
7 out of 10. Now that's a big number. We often say in India, like, my gut feeling is. So if I say one of the most important, like you just said, that it's like a combination of 15 organs.
Yes.
But normally when people take, मेरे पेट में दर्द है, I have a stomach issue, like I have acid reflux. So, like, what do you think is the most common problem when we talk about gut?
Well, the most common type of issues with the patients which come to me, most common is acidity.
Acidity. Yes,
They
I
say,
was
"I've got
about to ask
acidity,
you.
we have got burning in the tummy, we have got reflux, heartburn happening. Some people say you have a lot of gas bloat. That means they
Bloating.
always have a bloating of the tummy.
Flatulence, yeah.
You know, either they keep on burping or they have a lot of gas bloating, they keep on passing flatulence. This is the second issue. Third is bowel-related complaints. See, nowadays we are seeing many patients who are coming with symptoms of irritable bowel syndrome. There is more number of times they have to go to pass stools, which they're disturbing them in their day-to-day routine. And as the age increases, the other way around starts happening. They start developing constipation. Invariably, every person above the age of 60 or 65 or 70 develops some constipatory issues or the other. And that becomes their center point. Their whole life revolves around that one particular issue, that is of constipation. Of course, in addition to that, we have other issues like pain.
So, sir, how do you deal with this acidity? Let's talk about acidity and acid reflux. People say that a lot of doctors prescribe these days medicines like you have Pantop D and or maybe Pan DSR, and I'm just like, I'm not, this should be, no brand should be named, but people take it for lifetime. And then there are like people who once a doctor. How good is that? How do you deal with acidity?
You know what? Acid production is normal in every human being. Every human stomach produces 1.5 liters of hydrochloric acid to digest the food, pre-digest the food.
Okay.
But that acid doesn't give trouble. So, in case that acid is creating harm to the stomach lining, so if the stomach lining gets damaged, then it's like pouring acid on an area which has got damaged. It's going to burn.
Okay.
Or for example, there is a valve between the food pipe and the stomach,
Okay.
because of which that acid from the stomach can't come in the food pipe.
Okay.
And food pipe, that esophagus, can't tolerate even one drop of acid. Even if little acid comes up, you start getting heartburn.
Okay.
Now, because of changing eating habits, wrong practices, this valve can become loose, the acid can start coming up, and then the burning starts, heartburn starts. What are the common wrong practices? Number one, eating the food too fast.
Okay.
Gulping the food. People
That
are not
causes
having-
acidity.
Yeah, one of the common causes of acidity.
Okay.
Where they are not getting time to chew. So without chewing the food, they are gulping the food fast, because of which they swallow a lot of air. That air compresses the stomach, and that pushes the food and the acid both up.
Okay.
Second
Yes.
is eating too much portions at one time,
Okay.
keeping too long a gap between two meals,
Okay.
and then having a late dinner, and that too a heavy dinner, and then immediately going out to sleep. So all these are common issues, in addition to, of course, getting some infection like H. pylori bacteria through uncooked food or food which is kept or stored outside. That can cause lining inflammation of the stomach, and
Leading
that
to?
also manifests like acidity.
Acidity. Now, I have so many questions to ask
Yeah.
you, so many problems that we. What should be an ideal gap between two meals? So, for example, I had my lunch at 1:32.
Yeah.
What should be my like? When should my next meal be?
See, the stomach empties after 3 to 4 hours.
Okay.
So ideally, you have to keep on putting some food every 3 to 4 hours into the stomach. It need not be a meal.
Okay.
It can be a small snack. It can even be a cookie. It can be a biscuit.
Okay.
But if you eat that, the acid which is getting produced constantly gets neutralized.
Okay.
And that is exactly the reason why you see animals, they are constantly eating. They are grazing.
Okay.
Nobody has taught them.
Okay, that's a new thing that I have learned today. So now next question, now gas and flatulence. Like one thing that everybody says, I have a gas problem. Like I have seen most, like 9 out of 10. The research says it's 7 out of 10. I would say 9. What do you think is the most common cause, and when we should be worrying that okay, now this needs a treatment? A lot of people ignore it.
Yeah. So 9 out of 10 you said, 9 out of 10 of those people have one wrong habit likely to be, and that is fast eating. Fast eating, what happens is every time you swallow the morsel, you swallow gulp of air. And that air has to go somewhere, right? So that air gets trapped in the intestine, and that causes bloating.
Okay.
So fast eating should be reduced immediately in those people who have got bloating. Second is type of food. There are certain types of food which can cause gas formation, like cruciferous vegetables, for example, or like beans, or like chole, like rajma, or too much of garlic, too much of onion.
Okay.
They are known to cause gas formation.
Yeah. Chole specifically,
Yes,
like
yes.
most consumed food in North India, basically
Yes.
Delhi chole, bhature and all.
Exactly.
So that is,
Yes, that can cause gas formation. And third is, of course, food allergy. It can also lead to gas formation.
okay.
So you need to get yourself checked for any food allergies and try to avoid that type of food.
So now I have seen a lot of people like having their churans and all, like some powder maybe, or I've also seen people taking now these days Softovac or something of that sort. But they're like those churans, those Kayams and this and that. So like they have a regular thing. Is it a good thing to do?
It depends upon the reason they are taking it. Many of the people take such type of churans for having a proper bowel movement, because they feel that they are not clearing their stools properly.
Okay.
And until you get that clearance, they don't feel satisfied and they are irritated throughout the day.
Okay.
So for that purpose, they take it. But the problem is that some of these churans contain very strong stimulant cathartics or laxatives. So it's like whipping a horse. If you keep on taking these churans, then it becomes habit forming. And then you will not be able to pass or clear your bowel unless you have taken that particular churan.
So you have become addicted to it.
Yes, so you should do natural things. So natural things is plenty of water.
Okay.
Make sure that you eat plenty of green leafy vegetables in a cooked form, preferably not uncooked.
Okay.
Third, eat fruits which can lead to proper bowel movements, like papaya.
Okay.
Very simple technique, or very, very simple technique in those people who have constipation is to drink 1 cup of warm milk with mix 2 teaspoons of pure ghee.
Okay.
Mix it at night and drink it. It gives you a very nice movement in the next day without using any chemicals.
Okay. Okay, that's wonderful. Now again, gas now leads to constipation. So I've like done all my research. What are the problems that people normally face when you talk about gastroenterology? And one thing that has, again, like you must have be hearing that daily in your clinic, and people coming like, I have constipation. How different is constipation from a normal gas problem? Or is it like both are same?
See, constipation is improper bowel movement, improper clearance of stools, or inadequate satisfaction, improper satisfaction. So that is completely different from gas formation. Gas formation is bloating.
Okay.
But if long-standing constipation is there, constipation can lead to gas formation.
Okay.
Why? Because the gas is getting trapped because you are not clearing your bowel.
Okay.
So constipation also, when patients comes to us, we have to know what type of constipation. Some people go more number of times, but they don't clear. That is a constipatory type of irritable bowel syndrome.
Okay.
Many people don't have the urge only to pass. Some people pass, but it's too hard. So it's a different type. So each constipation type is treated in a different way.
Okay, so now you have just used, like, my next question was about irritable, for lack of time, otherwise we would have spoken at length about all these issues, because there are a lot of, you can say, there's a fake thing going on social media. A lot of people become expert that ye khane se 4 din mein your constipation will get over. Every day you drink some kind of mix, a bit of cinnamon, bit of I don't know what all, can like mix 5-6 product and then boil it and then take this warm water. I wanted you to, sir, throw some light about that irritable bowel syndrome that you just spoke about. Like, is it actually a disease, or is it a mental frame? Lot of people in, like, in rural area and all, they don't treat it as a disease. They think that it's iske man mein ye hai. You go to washroom, you don't pass stool, but when you come back, you again feel like going to that. So is that what, is this a disease, and what will you like?
See, irritable bowel syndrome is not a disease, but it is a symptom complex.
Okay.
There are various types of symptoms are called as irritable bowel syndrome. For example, commonest type of irritable bowel syndrome is, as you rightly said, you feel like going to pass motion every time, and every time you go and come, you are not satisfied.
Correct.
Again, you feel the urge again.
Correct.
So now, many times, this is a plain simple irritability of the bowel, which is usually seen in people who are stressed out, who are thinking too much, because there is a direct connection between the mind and the gut.
Okay.
For example, a child, he has to go to the school, there's an exam, he feels like immediately going to the loo. Now, why does that happen? That's because of mind-gut axis. There's a relationship.
Correct.
So, number one is you have to quieten down your mind and do simple practices to help you do that. So, that is one of the treatments of this type of irritable bowel syndrome. If there is painful irritable bowel syndrome, we give something different, we treat it in a different way. But it is just basically a symptom complex predominantly related to the mind.
Okay. I have also experienced that. Like, if I have a flight to catch, early morning flight,
Yeah.
I get nervous and probably I go to washroom more than what is required.
Yes.
So you think, is that a irritable bowel syndrome?
That is IBS.
Okay. And how do I deal with it?
Well, for that, you should take some simple medications
Okay.
to calm down the activity of the bowel, so that the bowel doesn't get irritated.
Okay.
Until you can control your mind and you don't be nervous.
Okay.
Because once you fall into that habit of getting nervous every time you have to achieve something or go somewhere, then you will not come out of that cycle.
Okay.
So you have to treat your mind for that. Not by medications, not by psychiatric medications. Self-suggestion.
Okay. Doctor, now my next question is about, a lot of people talk about good bacteria, gut bacteria, bad bacteria. You should be taking some prebiotic or probiotic, I don't know, like before meal or after meal. What is your recommendation on it? Like, it's a very, I think the answer needs some detailed, it would need a detailed answering, but like, for a lot of people I have seen, like after having lunch or dinner, they have something, they say it's a probiotic thing, you should have it. What is your take on that?
See, there is no capsule or there is no medicine in probiotic which can rectify your gut bacteria. Because the gut contains 38 trillion bacteria.
Okay.
And 38 trillion is more than the total number of cells of the total human body. So our body contains more bacteria than we ourselves.
Okay.
Now those bacteria are controlling our entire immunity, they are controlling our mind, they are controlling our digestion, they are controlling a lot of functions in the body.
Okay.
And these bacteria have developed over years. It is not a few days. So what happens is, right from birth, between cesarean section and vaginal delivery, the gut bacterial flora in the baby start developing. So vaginal delivery is always better than cesarean section.
Correct. That's why doctors
Yes,
say.
because of the gut bacteria. The gut bacteria develop better. Now, over the years, because of the wrong eating habits, different environmental toxins, etc., the bacterial population changes. There are 7,000 strains of bacteria in the gut. Now, these have to remain in proper balance. If that balance gets disturbed, then you start developing various issues. Even symptoms like irritable bowel syndrome, you may have even obesity, you may have diabetes, you may develop cancers, you may develop mental problems, mental mood changes.
Because
Everything
of
can
the
happen
gut-
with gut
gut
bacteria.
problem, yeah.
Yes, and allergic illnesses like psoriasis or asthma or even urticaria, skin rashes. Such things can develop because of bad gut bacteria. Now, you can't treat it only by a pill. You have to change your eating habits. Fresh fruits, fresh vegetables, not to eat stored things, and colorful vegetables and fruits you should concentrate on.
Okay.
And altered milk products like curds or
Okay.
buttermilk,
They help.
which contain natural gut bacteria.
So it's the natural thing should always be
Yes,
preferred.
always prefer natural.
Okay, all right, doctor. On that note, tell me what are the signs that like I should be worried if I have constipation or bit like occasional constipation, you may say. Like when should I go and meet a doctor, and what is basically a red flag, like
See-
about your gut, that there's something wrong with my gut.
Yeah, I think that's a very nice question because that's everyone should remember. Number one is you're eating normal food,
Yes.
but you have started losing weight.
Okay.
So unexplained loss of weight.
Okay.
It
That is
could be
one
something-
sign
first
for
sign,
a
first sign.
gut health.
Second sign is recurrent acidity, recurrent dyspepsia.
Okay.
All the time you're keeping on popping pills.
Okay.
But if this keeps on continuing, it can be a marker of early gastric cancer.
Okay.
We have to remember that.
Okay.
Number two is unexplained recent change of bowel habits. All the time you have been going normal to the motion, and suddenly since last 2 months you have started developing constipation.
Okay.
Always get it checked.
Okay.
Or if there is alternate constipation and diarrhea. Sometimes you have diarrhea, sometimes you have constipation, which was not happening before. Get it checked. If the tummy suddenly starts becoming big,
Bulging out.
get it checked. So these are some of the things, and of course blood in the stools.
Okay.
Anytime you notice any blood in the stools, your alarm sign.
Okay. Okay. Dr. Amit Medhev, it was absolute pleasure talking to you. I know you are in rush, or else we would have a very, very longish podcast. Like there are a lot of other questions that we will cover probably in our next interview.
Thank
It
you.
was a pleasure talking to you, sir.
Thank you so
Thank you
much.
for your time.
Thank you.
Thank you.